Hello and welcome everyone to a new episode of People and Science Live, streaming on LinkedIn, YouTube, and X. This is a new series by Karger that aims to bridge the gap between the people behind the science and the world around us. In this series, we delve into the stories behind the research, exploring the personal journeys that connect us all through the lens of science. Today, we are thrilled to share the story of Nicky, whose personal experience with lymphoma led her to become a passionate advocate for patients. Her journey underscores the importance of empathy and understanding in medical research and practice, highlighting what researchers and practitioners can learn from truly listening and engaging with the patients they work with. I'm Francesca Brazzarotto, and it is my absolute pleasure to introduce our guest, Nicky Greenhalgh. Hi, Nicky.
Hello, Fran. Thanks for having me.
Thank you for being here. Nicky is an inspiring advocate and founder of Living with Follicular Lymphoma, the largest online support community for individuals affected by this condition. Her journey with follicular lymphoma began in 2014, where she was diagnosed with stage 4 non-Hodgkin's lymphoma at 32 years old. At the time, she was a full-time mortgage broker and a dedicated mother of 2 young children. Despite the challenges she faced, Nicky transformed her experience into a mission to help others, becoming a passionate advocate and an oncology clinical nutritionist. In addition to her advocacy work, Nicky has contributed to the Fast Fact book on follicular lymphoma, published by Karger, that you can also download for free from our website, so please feel free to. And she consulted on this important resource, which provides clear and accessible information about the disease for patients and healthcare professionals alike. So let's start with your personal journey, Nicky. So can you tell us what led you to become a patient advocate, and what was the driving force behind your decision to focus on this very important work?
Yeah, so as you mentioned, I was diagnosed with lymphoma when I was 32. So that was 10 years ago now. And the type of lymphoma I've got is it's called follicular lymphoma. So it's an indolent form that is currently incurable at the moment. So I think the part in my journey that led me towards patient advocacy was actually finishing treatment. So I went straight into treatment from diagnosis, and it was a year-long treatment of radioimmunotherapy. And at the time, I felt really empowered as a patient. I was doing something about it. I was very green. I didn't know very much about the medical industry, but I was feeling good during my treatment. But it was after my treatment was when I hit a wall, and I was severely depressed, severely anxious. I left my treatment with the information that what I had is incurable, and to expect it to return in approximately 3 to 5 years. But if it returned within 2 years, my prognosis of 10 years becomes much worse. So I walked out of that hospital just absolutely devastated and trying to get my life back to normal. But I didn't have access to the information that I needed and the people that I needed to help me get through that part of my journey. And for about a year, I just struggled really badly. And it wasn't until I realised I needed to speak to other patients, other follicular lymphoma patients who I could actually relate with and help lead me to the information that I needed to carry on and give myself the best possible health outcome that I could, and not be so scared and anxious all the time. So yeah, that's what led me into patient advocacy in the first place.
Wow, that's quite a journey, right? And I guess going through a serious illness like lymphoma can be incredibly challenging, as you mentioned, not just physically, but also mentally. And I was wondering if you could share your thoughts on the mental health journey that patients like you, even with other diseases and other type of cancer, of course, go through mentally. Could you share on how the mental journey can be for patients, how important it is for healthcare providers, researchers, clinicians to consider the emotional and psychological aspects when dealing with patients like you?
Yeah, so most of the time when patients are diagnosed with cancer, they've a lot of the time they haven't been faced with any kind of medical situation. I know for myself, I was in my early 30s, and for me at the time, I felt I was untouchable, and I was going on living my life, not even considering my health. So it was a huge wake-up call for myself, thinking, okay, I need to take control of my own health if I'm going to grow old and meet my grandkids, which was the ultimate goal for me, because being told my prognosis was 10 years was completely devastating. And the prognosis thing really affected my mental health. If there's one thing that I could say to clinicians and practitioners, prognosis, no one can tell you when you're going to die, and it really sticks with a person. Like, if even 10 years, at first I thought to myself, oh, at least it's not 6 months. I'm grateful to have 10 years. But then I counted how old my kids would be at that time, and that number just stuck in my head. And I think that was the driving force to my mental health breakdown, one of the major driving forces to that. So it's very mentally debilitating having, being faced with the diagnosis, but also being faced with your own mortality, because we automatically think of that when we hear the word cancer, unless you've been educated around cancer and to not be so afraid of cancer. And that's where I'm now. I'm not afraid of it, and I'm feeling happy, and that's where I want to help other patients get to that stage. And I think clinicians can really help patients in that way as well.
Yeah, I understand. And thanks for sharing your feelings with us as well, because I think it's such an important part of the whole dialogue, is that, when clinicians and researchers are, going through this probably, trials to try and figure out what's the best course of action. Sometimes they tend to, I don't say forget, but they might not take into consideration the psychological side and what patients are going through. They're human beings, they have families, they have their own life that, suddenly, finds this obstacle in the way, which, as you say, if you have a prognosis that it doesn't sound that good, can really, really affect you badly. So I have a few questions around how researchers and clinicians may, go around the clinical trial side of things, but also going back to, sharing your personal story while advocating for needs of a broader patients community, which I think is also a very interesting question. So let's start with that. How, you have a very your own health journey with lymphoma. How do you maintain that delicate balance between passion and whatever you have felt during that time and objectivity in your advocacy work?
I think it's just really important to understand that every journey is different. Every cancer patient's journey is very unique, with different challenges, treatment responses, emotional impacts. So I think that's really important to take into consideration. So I think my personal experience has undeniably shaped my perspective, but I've also learned to use that experience as a starting point rather than a sole focus of my advocacy. So just actively listening to the patient and learning their journey and how it has affected them, but also at the same time finding some common ground between us. And I think that helps them as well to know that I've been through my own journey and we can find some common ground there.
Right. Okay. And so we know that patient advocacy is so crucial now more than ever in healthcare and research sectors. Do you think there is a way, via maybe publishing, like the project you've done with Karger, there is a way for patients to influence the practices of healthcare providers and researchers, like on a practical level?
Absolutely. I think patient advocacy is really crucial in the healthcare and research sectors, mainly because it centres on experiences and needs and the voices of those most affected, which are the patients. So the advocacy, it just ensures that the healthcare is patient-centred, and that the not just addressing those clinical aspects, but also the emotional side of things, and the practical needs of the individual. So I think that's it's a really crucial part of healthcare, and particularly also in the research sectors.
Right. Yeah, absolutely. And you recently, as I mentioned, collaborated with us at Carger to publish a book for patients with lymphoma. I would like to ask you more about your experience working with a publisher, and also if you can tell us more about this project. What do you think? What kind of impact you hope it will have on patients and the healthcare community, so also practitioners?
Yeah, well, I actually have the book here. I don't know if you can
Oh,
see
nice.
that. It might be a bit blurred. So I'm lucky to get a hard copy of the book. And look, it's a really amazing book, particularly for patients who are newly diagnosed, because it
Mhm.
really asks the main questions that are asked for a newly diagnosed patient, particularly with follicular lymphoma. It explains what it is. It also helps to educate the patient on the lymphatic system, because I didn't even know what a lymphatic system was when I was diagnosed. I didn't even know lymphoma was cancer. So it's, everybody's at a different level when they're, particularly at diagnosis. So this book really covers all those aspects. It also helps you to understand what treatments are available. It goes into testing, side effects, and also explains that with this particular type of lymphoma, a lot of people will go on what's called watch and wait. So they won't go into treatment straight away. The majority of patients won't. So it's really important to explain that, because I know when I was newly diagnosed, the idea of watch and wait scared me, because I just knew I had cancer in me and I wanted to get it out. And a lot of people feel that way as well. But now, knowing what I know now, I think watch and wait would have been a great thing for the patient because it gives them that time to really do their research and learn and understand what they're about to go through, and just be able to arm themselves with everything, all the resources that they need.
Yeah, absolutely. And I think, to be scared is to not know what's going to happen, what is happening to me, to my body, right? So
Yeah.
I think that creating a guide that will help you navigate these tough times and mixes a bit of, the majority of very like practical information and everything you should know just to be aware of what's going on and how you can expect certain therapy to impact your body. I think it's really important. And as I said, also to explain how to take care of yourself mentally, while going through this tough time. And I think this is training that should be offered, both to patients and obviously to clinicians, researchers, when it comes to these clinical trials, for example, and the whole therapy. Because as you said, sometimes you know when you start a therapy, I guess you feel certain, like you're doing something, you feel like you're active, being proactive, I think you mentioned, right? And that's great, but then at the end of it, I think you might feel a bit lost, because what am I going to do now? So what do you think, practitioners, or when you go to a hospital, what do you think should be the system surrounding a patient so that they can feel protected and also like followed throughout the whole journey, not just at the beginning and throughout the therapy?
Yeah, I think emotional support should be provided right from the get-go, particularly when they're going into like a new treatment that they may know absolutely nothing about. Like immunotherapy, I didn't know what immunotherapy was. I didn't know what to expect. So I think it's really important for the clinician to make sure that the patient has all the resources that they need. And something that's very close to my heart is nutrition and lifestyle choices for a cancer patient. I think it's very empowering for a patient to learn how to take control of their own health. Like we spend maybe 10 minutes with the clinician, and 9 times out of 10 you walk out of that office and think, oh, I should have asked this or I should have asked that. So making sure that the patient has all those resources available to them right from the get-go, to be able to actively take control of their own health, and particularly, like I said, nutrition. I think that needs to be implemented. Learning how to give yourself the best possible outcome, and like there's so much research coming out with the gut microbiome, how the effects of the condition of your microbiome, how it can improve your health outcome with treatment. So there's so much research going on at the moment, and I think keeping the patient at the centre is going to help move that forward a lot better.
Yeah, I agree. And you being an oncology nutritionist, clinical nutritionist, so did you get any information at all about your nutrition after your diagnosis and after the treatment?
No, I had nothing. Oh, the only thing I had access to was Google, and I went and made a lot of mistakes. You hear things on the internet like because the fact that mine was incurable, I was determined to find a cure. So I went crazy researching Google. I looked into just anything like apricot kernels or alkaline, all those little things. I didn't know the why. I just read that this could potentially cure my cancer. So what people don't realize is that everybody is different and everything needs to be tailored, which is why you need a practitioner to help guide you through that process. I remember when I finished treatment, I was so completely lost. Like I walk into a supermarket feeling empowered, like I'm going to buy myself the most nutritious food, and I'd end up walking out with an organic banana, just crying my eyes out because everything in the supermarket, I Googled and I could find there was some reason why I shouldn't eat that. And I ended up becoming quite malnourished because of that.
Which is worse, which is exactly what you don't want to be.
Absolutely. It could have been a lot worse for me. I was lucky that, I didn't, it didn't affect my health even more. But it's very common for cancer patients to become quite malnourished after their treatment.
Yeah, I understand, and I think it's so important to just look at the whole everything surrounding a patient. And I know we say patient a lot, and I like to say, it's a person. And I think patient tends to kind of detach me from the fact that it's a person with connections and a life and everything else. And I think that sometimes there might be some researchers connected now or watching the video, and we talk at Cargill, but also publishing level we also talk about research, and we look at things like data and outcomes and things like that. But really, the important thing is that why we're doing this, why are you researching certain things, why you're trying to achieve, and why your research is so important is that you can help people in the community, in your community, right? And the friends of these people and the family of these people. So when creating, these clinical trials or these research and case studies, just let's ensure that they're more human and person-centered, patient-centered, and being considerate of the whole experience, right? And taking that into consideration when writing about them, but also coming up with these ideas.
Yeah.
So I think this is very important point that you highlight. And if we had other patients, people going through the same path as you have, so for someone interested in becoming a patient advocate, what advice would you offer? What skills or experiences do you believe are essential for success in this field, particularly in fostering empathy and understanding with the rest of the community?
I think what's really important is deeply understanding the patient experience. So very strong communication skills, I think, are crucial. So, and the ability to really listen to the patient and provide them with the empathy, that they need to feel heard. So I think. I just think that's a really important part, making sure that you're really deeply understanding the patient and where they're coming from, and showing them that you're here to help, and being able to provide them with the resources that they need for them to give them the best possible outcome.
Right. And listening to, because I imagine you've dedicated a lot of time to this, and you have a full-time job, but you're a full-time mom as well. So a lot going on. And giving that much time to this advocacy as well, work, do you think is also taking a toll on you mentally? Just, listening to other people's stories, going through what you've already gone through. Is it something that is affecting you or still affects you somehow?
Yeah, I've been asked this a few times actually, and I only think about it when I'm asked about it. Honestly, I feel like this is exactly what I'm meant to be doing. I'm so I didn't have a passion before I was diagnosed, and this is why, I know it sounds weird, but I'm actually really grateful for my diagnosis, because it's led me to find my passion. And I just love helping people, and I want to be there for the people going through this, because I don't want anyone to feel like I felt when I finished treatment, completely lost, absolutely terrified. I would hate for anyone to feel that. So I want to do everything I can so other people don't feel that way.
I understand, and it's great to hear. And honestly, congrats on being able to do this and being so good at it. Really, it takes a lot of strength. I think mental strength. I don't know in your position if I'll be able to do the same thing, but kudos to you, really. And we have a questions actually that just came in, and it ties nicely with our when we were talking about publishers being more involved also with patients. Here it is. So should medical publishers producing material for patients understand what patient centricity really is?
Absolutely.
It's also coming up on the screen there.
Yeah. No, I think the patients really need to be the centre of it. It's real life experiences and that highlight the needs of the patients. So, yeah, I think patients really need to be heard and understood. And also it makes the health information less intimidating and more empowering for the patient, and also relatable. So, absolutely. I completely think so.
Okay, thank you. And thank you, Catherine, for the question. And we can also just go back a little bit on the researcher and the work of, the relationship between patients and researchers. So how do you see this progressing? Like, if you could create a new system where patients are at the center of the research, the patient perspective especially is at the center of the practitioner and the researcher work, what would the best workflow be? What would the best scenario be, in your opinion, and taking in consideration your experience?
Yeah, I just think that if they can focus on the patient being the centre of all the healthcare decisions, so where the voices they're not just heard, but it helps to shape the policies and the research priorities further. It helps, I just think it needs to be the centre stone for research development, because so it can be steered in the right direction. Yes, because I think there's always room for improvement there, and I think finding out exactly what the patients need and what is most important to them is absolutely so important.
Okay, so it should be done at the beginning of the research work, right? It should be just done, okay, if I have to do this clinical trial, I just need to think about ABC before I can start getting patients involved, so that or I can already start talking to them to see exactly how they can be supported, right? Until something is created, a workflow is created, and then we can follow up step by step, take into consideration the feedback from the patient. It's also true that the patient in that case might be a bit overwhelmed because they are in a different headspace than a researcher that is working. So do you think they'll be able to help out while in the process? Do you think they'd be you see things from as a something that has already happened, so you can see it with a bit of clarity? So do you think you could have helped as much if you were helping during the whole trial?
Look, to be honest, I think somebody who's been through it is probably best as to be on like a patient advisory panel or a council who's gone through the whole process. During the process, it's very difficult to really know what you want to say or what you want to get out of things. I think for a patient advisory, it really needs to be someone who's been through the journey, who's on the other side and feeling, confident, like myself. I'm confident. I've been through it. I know, and I've spoken to a lot of patients about it as well, and really tried to understand their journeys as well. And also like patient-reported outcomes, like right at the end, maybe that might be a way of doing it, where a patient has, at the end of their treatment, helping them or they can help by sort of listing their experience and what would have been better for them. Yeah, so I think either then or later on down the track would be the best.
Excellent. Okay, thank you. So I hope that, you know, the researchers that connected today have found some important information to keep in mind before going back to work. So, you know, be careful and be aware of the people you're working with, take care of their mental health, and that make sure they have all the information they need so that they feel secure in what they're doing, and, you know, they're helping you out as well. So be mindful of that. And for everybody out there who would like to be a patient advocate, I hope that Nicky's tips will be useful to you. And I'm sure that out there are many other advocates that, you know, have shared their experience online, but just don't rely everything like on Google exclusively. Have a look at some of the material that some of the medical publishers are putting out there. And Nicky, if you want to remind everybody of the book you've helped publishing, so with us, the on lymphoma. It is follicular lymphoma.
Yep. Fast facts for patients with follicular lymphoma. Yeah, I'd also like to add the digital platforms like social media communities. They've really they're so important. I think clinicians would serve them well to join these communities and really hear what the patients are experiencing and where they're finding trouble and what is really important to them. You can get on there and you have a wealth of information there. And I think that's really, it's a game changer for the healthcare industry.
Fantastic. So yeah, so if you want to start a trial of some kind or a research study on something, just go online, try to find a community, a patient advocate in that specific area and discipline, and liaise with them, right? And just make sure you are aware of the facts before you start. That's a great idea and great tip. So thank you so much.
No
okay, so I wanted to, this was a lovely chat. Thank you again for sharing your story, Nicky, and, you know, your feelings and everything. I think it's very important for us to know these things, because you never know who's been affected or can be affected by something like this. So it's great. Thank you so much for sharing your story.
No worries.
I just wanted to end on a lighter note, so to speak. So it's the time of our random question. So are you ready for our random question of the day?
All right, I'm ready.
Not that bad. Okay, so Nicky, if you could magically make one superfood taste exactly like any junk food, what would your dream combination be? So, for example, kale that tastes like chocolate, or broccoli that tastes like French fries.
Actually, that's easy, because there's one food. Well, there's two foods actually that I would love to love, and I know they're good for me, but I just can't stand the taste. Salmon. Salmon is so good for you, but I just can't stomach it. So if we could make salmon taste like chocolate, I'd really appreciate that.
Okay.
And the other one is tofu. Salmon and tofu.
All right. Okay. Tofu to taste like what? Chocolate again, or?
Chocolate will be fine. I'll take chocolate.
Everything chocolate cover. Okay, right. Well, perfect. Thank you so much for answering this, and thanks again for your contribution and for this chat. And it's been a pleasure.
No worries. Thank you so much for having me.
And to all of you at home, thank you so much for dialing in, for watching this video. And if you didn't manage, I hope you'll see the recording. So you know, the next episode will be already on Monday, the 2nd of September. My colleague will be interviewing Dr. Labrick from the World Health Organization, and it will be about digitization and AI in biomedicine. So a really great topic, and hope to see you all there, and see you next time. Thank you so much for dialing in, and see you next time. Thank you, Nicky, again.
Thank you.
Goodbye.